It is estimated that out of 1 lakh people, 55% dies just because of cardiac arrest. And the figures are really alarming, but the figures are also very vague. In the United States, it is estimated that 3.5 lakhs people dies annually just because of cardiac arrest. Unfortunately, in India, the real statistics are not available, and if you really go for the statistics, it will be much higher. How can we prevent that, or how can we manage this situation? We are going to discuss about the basic cardiac life support. So this is Gerald Cherian, the CEO of Sarvodaya Skill and Simulation Lab. Why BLS is important? Because a sudden quick action can save a lot of life, especially the heart when it is in trouble. And today we are going to discuss few concepts about this basic cardiac life support. First of all are the patients, those who require this emergency management. In roughly, we can say that one is patients with a heart attack or with a cardiac arrest. Even though interchangeably we often use this word heart attack and cardiac arrest, but these words are significantly different when meaning wise also. Now, if a person's heart is not pumping adequately, so we have to restart the heart with cardiopulmonary resuscitation. Obviously, if person's heart is not beating, obviously the lungs is also not, the breathing is also not happening. So both the system, we have to restart it with CPR, cardiopulmonary resuscitation. How we can recognize that a person is with a cardiac arrest? So it is, if a healthcare professional, the best method is to check the pulse of the victim. Today, I am going to discuss only patients who is adult and what are the protocols. Now, for all adult patients, if you are a healthcare professional, you can check the carotid pulse. And when you check the carotid pulse, simultaneously, you look into the person's chest or the victim's chest for the person is breathing or not. So we can see that if the chest is rising and falling, that is the signs of breathing. If it is not happening, it considers that absence of breath. So if a person's pulse and respiration both are absent, so immediately you have to activate the emergency system or the emergency ambulance which is nearly available, and you have to immediately start the CPR. While performing CPR, we have to follow 5 critical concepts. So these 5 critical concepts, it may be vary from country to country, because UK got their own guidelines, US and Canada got their own guidelines, Australia and New Zealand, they got their own guidelines, Netherlands got their own guidelines. Recently, Saudi Arabia started with the Kingdom of Saudi Arabia. They started with their own guidelines. But today, what I am discussing is based on American Heart Association's guidelines, the 5 critical concepts. You may have disagreement with this, but I am just following American Heart Association's guidelines because they do a lot of researches on the cardiac arrest management, and that is widely accepted also. And here I wanted to emphasize one more thing. Thank you very much for Indian Nursing Council, because even though this curriculum was already present in the nursing curriculum since beginning, but recently past 3 years, the Indian Nursing Council has given much more importance for this basic cardiac life support, and they add it as a mandatory module which every student who is studying in Indian Nursing Council must complete this particular module. Now we'll quickly look into the 5 critical concepts. The first critical concept is push hard, and the second critical concept is push fast. Third critical concept is allow the chest to recoil completely after each compression. The fourth critical concept is avoid excessive ventilation, and the fifth critical concept is minimize interruptions. Now, in detail about this critical concept, we'll come with the next video. Hope that you got a minimum idea about this basic cardiac life support, and thank you very much for watching. We'll come with the next video about the detailing of the critical concept. Thank you.